Good afternoon. My name is Nate Bailey, and I'm working in collaboration with FamilyKind, a nonprofit organization that empowers children, parents, and couples before, during, and after separation or divorce. We are able to bring to you this peer-to-peer webinar series for professionals free of charge because of the generosity of our two sponsors, and those are Our Family Wizard and SoberLink. Now, I'm a representative with Our Family Wizard, which is a comprehensive app that enables you to conduct all of your co-parenting communication on a single platform. Powerful tools document your parenting time, reimbursement requests, payments, exchanges, and more. This means less conflict and more energy to focus on your children. SoberLink supports accountability for sobriety and child safety, combining a breathalyzer with facial recognition and wireless connectivity for real-time results and reports. SoberLink's new family assistance program offers alcohol monitoring free of charge to anyone who qualifies. By increasing our total reach in our mission of supporting families affected by alcohol abuse, this program will help continue to reduce litigation and foster peace of mind. So today's webinar is entitled The State of Family Science, and we are going to learn from two experienced professionals today, Ellen Tanner and Gerald Cannon. Gerald Cannon is a community liaison and parent educator with FamilyKind, and Ellen Tanner is the Director of Parent Education and Children's Programs. To learn more about our speakers today, you can visit the FamilyKind website for their full bios. A few housekeeping notes. The Q&A is open, and if you have any questions throughout the event, feel free to put them in the Q&A. We may answer them throughout the presentation or take some time at the end, depending on how much time we have left. We will plan to run for 1 hour today, so hopefully we are able to answer everyone's questions by the end. But now it's my pleasure to turn things over to Ellen and Gerald.
Hi, welcome everybody. And hi, Gerald, great to work with you. I'm very excited to be here with everybody. You know, FamilyKind offers parents a variety of support from many family science and other skilled professionals. This webinar will explore the many sides of family science in state and national arenas. We have a poll that we're going to start right off with, so we can hear from all of you. Have you heard of the term family science? Let's say yes or no. Oh, that's wonderful. So, right, Gerald, they're great. Most people have not heard of this term. But we're going to identify family science and what it is. We can go to the next slide with the as if family, and the one after that, thank you. You know, I like to think of family science as the trunk of the tree with many limbs. And this slide presents many of the limbs, and this is just a sampling. These are the ones I've been most involved with and know the most about, but I know that through my 40 years in this field, there have been so many new organizations that have populated and percolated. So we have a lot going on. I'm going to start with the very first one, and then I'll turn it over to Gerald for some more information. The very first one is called the National Council on Family Relations. This organization is close to 80 years old. It oversees the programs that are in 170 plus universities that are granting the certification for family life educators. And they also do a lot of advocacy work for our profession. They have a full staff that works on it. And I will now ask Gerald to talk about NPEN.
NPEN, amazing National Parenting Education Network. They deal with building up a lot of policies, participation on advocacy. I myself, before we go any further, I'm a member of the advocacy and policy panels. So it is, we work and deal with the policies and building up in informing parents and educating the parents on on the hearts of the families and how to develop the family. You had mentioned something early on, Ellen, that there's the tree, we're the trunk of the tree with many limbs. And NPEN is exactly that, the trunk of the tree with many limbs, the heart and one of the major pillars of the family science community.
This is true. I have the privilege of being on the council of NPEN and the guidance committee, and I also chair policy and advocacy work that we do. There are also amazing committees that are talking about and have recently published the competencies documents for professionals and paraprofessionals of parenting education. There's also a campaign called the Parent Education Matters campaign. And what we encourage lots of organizations such as 0 to 3, even some people at CDC are also showing the Parenting Education Matters most recent campaigns. The whole idea is to make parenting and family education the norm and a recognized profession, and NPEN is definitely on board with that. The other thing that NPEN has worked on is the whole idea of evidence-based programs. And evidence-based programs is now the new buzzword. I'm sure somewhere in your career you have come upon this. And the problem with parenting and family education having to be an evidence-based program is that the system to become recognized as evidence-based is a broken system. For example, we do not want to have people telling us that you have to have a control group of some family members of your agency that are served, and others that you serve get the program and some don't, so that you have a control group. That's just not ethically correct for some of the agencies that have amazing programs that really make a difference in the lives of parents, their children, and the extended families. So I encourage all of you, take a look at the ncfr.org website and NPEN's website. There's also another organization that has recently grown. It's probably about 4 years old, which is the Family Life Coaching Association. And many people are familiar with coaching. You know, you go to coaching for sports, or you go to coaching for wellness. Well, what about family living? And how can you help families grow to become the best versions of themselves? The other thing that this organization is doing is working on the certification process for coaches. And there's also a lot of advocacy work going on. And I'll give you a couple of examples. So for example, we have grandparents or kinship caregivers raising grandchildren. I recently had the privilege to work with a woman named Tina Fagel at the FLCA conference. And in that conference, we spoke about foster care. Often one of the fastest growing populations of foster care providers are relatives, grandparents, and kinship. And the reason it was such an honor to work with Tina was because she was instrumental in developing a program that taught children in foster care who become intense children. She didn't teach the children, she taught the family members how to help these intense children not have to go from one home to another home to another home to, we call that replacement. You know, very often when children are intense, foster care providers, whether they're family members or not, don't know how to work with these children, how to help them feel loved and heard and healed. And so her program was evaluated, picked up by an agency. The replacement rate of children in the state of Wisconsin was so dramatically decreased because of this program that they used discretionary money from their Medicare and Medicaid funds to have the foster parents trained in this curriculum, and they can actually bill Medicaid for that. The agency that provides it bills Medicaid for it. So that's just an example of what can happen with effective programs. And it just totally has transformed, you know, the foster care system. Unfortunately, though, we need more states to accept that parenting and family education and coaching are services that can be funded. And we're going to circle back to that in just a moment. I also want to make mention of the National Association of Social Workers. I love social workers. My daughter is a licensed clinical social worker. Their primary focus, though, is on intervention, whereas very often family science prevention professionals focus on prevention. And another organization is the American Association of Family and Consumer Sciences, AACS. Most of us, if you're of my generation, knew these in schools as home ec classes. They do so much more, and I encourage you to look into them as well. Another organization that I am very proud to have been a member of for many years is SOPHE, the Society of Public Health Education. I have a master's degree in health education when the field was brand new, and to see how far it has grown is very reassuring to me. They do a lot of work with legislators on state and national levels to get health education policies implemented. So they are a great model of what some of these other organizations can do to, again, work on policies. So let's hear who you folks all are in our next poll. Gerald, you want to read that out loud for folks?
It looks like we may have lost Gerald for a moment.
Okay. Well, the poll, I'm sure you can read on your own. We have 18% of our audience today are lawyers. We have great amount of mediators, mental health professionals, no family science professionals yet. We have an educator and others. Well, this is great. Nice broad group. I appreciate that. Now, our profession, family science profession, has faced many challenges and has addressed them as well. So I'm going to do a shameless plug for something that I'm very proud of having achieved, which is having authored with members of the National Council on Family Relations, the white paper that is called, and maybe the next slide will help reference that. Matt, do we have the next slide? Thank you. It is called Family Life Education, a profession with a proven return on investment. And you notice I've underlined the term prevention of the U.S. Prevention Services Task Force. A lot of people may not know that when the Affordable Care Act was signed into law on March 23rd, 2010, this prevention task force was formed under the auspices of the U.S. Surgeon General. Because healthcare costs are so expensive, it is far better to prevent either illness or the acuity of illness than it is to have to deal with treatments and complications from various conditions. The U.S. Prevention Services Task Force, however, did not have any prevention strategy for behavioral health. And the white paper showed that we are the #1 prevention strategy for behavioral health, meaning mental health and addiction. Again, remember, this is prevention strategies. So that was the good news. That was really exciting. The not so good news was that we had to go state by state to get Medicaid to fund parenting and other family science strategies. Truthfully, what we would have hoped is that we would have been able to really focus in on each state's Medicaid proposals. However, we took a pause, and we then are now that there is an administration whose primary focus is on the family, or one of the most important focuses is on the family. And so we are updating our white paper because it was written in 2015, and we are making it a living document that will include input from the various organizations that you just heard me and Gerald talk about. Another challenge that we face besides Medicaid funding is insurance companies. And we are, in addition to Medicaid funding, we do have some HMOs that have funded evidence-based programs and practices. And we also have people who are advocating for the need for a diagnosis to be required for insurance companies for them to fund it. And that's a huge leap, but we're getting there. We have people around the country who are working on that particular focus. We also have people who would like to see insurance companies fund not just parenting education and family education with children, but there comes a point when we have elders in our family and the people who are responsible either with the elders or taking care of the elders to have family education. A lot of elders do not know how to talk to their children about end of life decisions or what kind of quality of life decisions they would like their offspring or additional family members to be focused on. So when we think of family science, I like to think of it as from womb to tomb, that there's services available throughout. I'm wondering if Gerald has been able to get back in yet.
Unfortunately, he has not yet reconnected.
Okay, then I'm going to just continue and he'll get here when he can. Another aspect of our challenges that we have faced and addressed and continue to expand on how we address them are policies in the criminal justice system. What we know is that when people who are incarcerated, number one, have access to their families and their children and are taught parenting and family life skills, when they are released from being incarcerated, their recidivism rates are drastically reduced. Another thing we know is that those kinds of interventions help to break the generational cycle of being involved in the criminal justice system. Parenting and family education makes a world of difference. Sometimes people who have been incarcerated for a while do not get to have access to their children other than very brief visitations. And there are so many wonderful things that have impacted the growth of the person while they are incarcerated, especially when it's tied to them having a relationship with their children and with their co-parents, because often there's a breakdown in that arena as well.
Yes.
Another focus that we have been addressing are state licensures and the certification of family science professionals. So for example, in New York State, there's a parenting education partnership, and they are a model for a national certification, which we do not have. The certification process has varying degrees of what you would need to accomplish in order to become certified. And just like COVID, the COVID pandemic changed certification for licensed clinical social workers needing to be state specific, we would like to see that for family science professionals as well. Also, as Gerald mentioned with NPEN, they have the documentation for competencies for professionals and paraprofessionals. So we're working to see if we can get many more states to have parenting education partnerships. And another model, which is just amazing, is in Minnesota, and they are the only ones in the entire country that has school-based parenting education, meaning that before children even get into grades, like pre-K and early on into the grades, the parents get parenting education. Parents are children's first teachers, the most important teachers. And yet, without that education, they often don't know what's the best strategy to use with their children, not just with discipline, but how to actually teach your children things. And they have an amazing curriculum they have for many years. We would like to see more states follow that model, and also to have more parenting and family education pre-K through high school. And high school children are so different than younger grade children. The eye rolling, the amount of time that they're with their friends, and screens, particularly during COVID. Parents have realized, I need help. It's been a huge challenge. So FamilyKind has adopted during COVID a Zoom parenting class for all parents, no matter whether you're divorced, separated or not, whether you are professional or not. If you're a parent or somebody who's a caregiver of children, you're welcome to check us out on our website and see more about the class. We actually have one starting tomorrow night, so it's not too late to register. And I have a few professionals who are actually joining us. Another thing that we're very excited about with this class, this is our first time that we are going to have a class for the deaf community and hard of hearing community. We will have ASL, American Sign Language interpreters, as well as closed captioning. So we're very excited about that. FamilyKind also has an adult children of divorce group. That's also found on familykind.org website. We often find children, when they go away to college, if they go away to college, that when they come home, their parents have filed for divorce. The house is empty and they want to separate. And children are really thrown by this. Or we have adults that happened to many years ago for them. So this adult children of divorce group has been a great resource for those people. The New York State Parent Education and Awareness Program that FamilyKind provides, that's a single session class. Our Zoom class that I just referenced is a 7-session class. And I'm a national trainer of several different curriculum. And so I was able to condense, because there are no Zoom parenting education classes that have been published. So I've adapted 2 of the top parenting education curriculum in the entire country into 7 one-hour sessions. However, when FamilyKind, before COVID, when I was, I'm responsible, as you know, for the Director of Parent Education, we have what's called the New York State Parent Education and Awareness Program. We are a certified provider by the Office of Court Administration. And one of the things that happened, of course, during COVID is we had to abandon that class because we couldn't do it in person. So we were very fortunate to get our online version approved by OCA, Office of Court Administration. And that curriculum that the parents take in person is now also available online. And we will continue that. We're very optimistic in the fall that we'll be able to start our in-person classes again. It's a single session, 4.5 hours. And there's a plus and a minus to having in-person versus online and vice versa. So I'm going to go through that with you very quickly. The in-person version helps other parents realize that they're not the only ones. Now, they can't take that class with their co-parent, but they'll hear other parents and realize they're going through the same struggles, and they may hear different perspectives on how to deal with those struggles. That's a huge plus. In one of the classes I taught a few years ago, was a few women got together and developed their own support network because one of the women had said, I'm going to be dispossessed from my house. My co-parent will not pay the mortgage, and that person is the breadwinner. So the other women said, oh, let's help. We can work with that. And so that's the value of an in-person class, some of the value. Now, here's the value of the online program. Number one, it's also 4.5 hours, but you don't have to do it all in one sitting. And so when the parents study, take the time to go through the different scenarios, they can actually pause and come back to it. From the time that they register, there's 30 days that they have access to the program versus the 4.5 hour session. Now, here's something that is FamilyKind has been working on for several years, which is as a member of Jrope. Jrope is headed by Judge Sandra Miller, and it stands for the Judicial Restoration of Parent Education. Because currently what we have in our law is that judges may refer parents to parent education rather than judges shall refer parents. One word makes a big difference. It's a little more complicated than that, but it's enough, I think, for you to right now understand a lot about our commitment to providing parent education. You know, there was a time career-wise that I oversaw substance abuse resources for people, substance abuse treatment resources for people. And when they would call asking for money so they could get into treatment, we would say, how old were you when you started using substances? And over again, we heard, oh, I was about 10 or 11 or 12. What was going on? My parents were getting divorced. And so what I said is, we can do something about that. I knew of this curriculum that we use called Children in Between, and it's nationally recognized. It's in 44 states. It's mandated in 26, maybe more states now. And that's the curriculum that we use. And so I brought that to the state where I was at the time. When I found FamilyKind and saw what they were committed to, it was as if I had found my spiritual partners, because they share my mission. So let's go to the next slide, if we can. And that is the value of family science, the clients we serve. Have we gotten Gerald back?
I am here.
Oh, wonderful. I'm going to pause and let you take over. Thank you.
When we speak about the value of FamilyKind, it really strikes a very personal chord with me. I'm retired military. I was a trainer in the military for, let's just say, a number of years. I retired, and so I know what it is to work with people. So, and you know, in coming out of the military, I was faced with divorce. So how to deal with that, I didn't know, but I recognized that I needed some help. I looked into a couple of things. FamilyKind was the only agency that responded to me, and it had impacted me so much to the point that now I've decided to, the second part of this life of mine, I've decided to go into the family science myself. The family sciences have allowed me to be in the crux of the family development, and that is, you know, what it is with the FamilyKind and the family sciences. It just allows me with so much hands-on in the capacity of prevention. I find, and it's been said before, that knowledge is power. And what I find the family sciences do for families, it empowers them. And it empowers them with the education. It makes them, it welcomes the education aspect to them. And when we empower them with education, they become more acquainted with the resources that are out there, and approach the people that are out there more or less to help them, i.e. the paraprofessionals, the lawyers, the teachers. You know, we make that whole interaction that much smoother, whereas before there's some resistance there. But the family sciences really opens the door for those resources to really communicate much smoother. So Helen, there has been so much, and I don't want to make it about how much the FamilyKind has impacted me, but you already know. And again, here I am pursuing my degree in family science. So it's amazing. It's amazing to be on board, and as always, I'm honored to be sharing in this peer-to-peer.
Thank you, Gerald. You're way too humble, because what you failed to share, so I'm going to, because I'm so proud of you and so appreciated appreciative of you, is that when you were in our class, you forwarded the action. It was, you never held yourself as a victim or had a pity party in the class. Instead, you forwarded the group. And when I spoke with you afterwards, I learned that you are a retired member of the Army and that you had been a trainer in the Army. And that had to have been amazing to the people that you trained, because you have a way of forwarding people and honoring where they are and bringing them forward. So it was a very good fit that you joined FamilyKind, and we're so appreciative of you. And you represent us at different events and committees and commissions and New York State legislators. You really have taken on the voice of FamilyKind for us, and we appreciate that. I also wanted to add that we appreciate professionals referring their clients to parent education at FamilyKind. You heard Gerald say what a difference it made. And it truly did, because I've seen the transformation in your family. You know, there was a time when you could not speak with your son's other parent. And now she, not only do you co-parent beautifully together, she also participated in one of the parent education classes that you taught. So that's the transformation that occurred, and that's bears sharing. You know what, as I mentioned before, parent education seeks to prevent and reduce the acuity of issues. When parents, when adults tell me that they use substances because their parents were getting a divorce and they were totally caught in the middle and they were self-medicating and constantly in the middle of their parents' fights, or their parents fighting with them because they were so angry with their own co-parent, you know, with the other parent, and taking it out on the children because they were just beside themselves. We want to prevent that from happening. When parents see our parent education class, they say, "Were you in my house?" Because we don't, it's not a therapy session. There are scenarios that the parents watch. And when they watch those scenarios, it resonates with them, whether it's dealing with putting down the other parent, or asking the child to carry messages, or asking them to handle money issues, or quizzing. So what happened at your parents' house? You know, who was there? And quizzing them and making them feel so uncomfortable. The parents realize that. And, you know, family science, you know, I am a huge proponent of evidence-based programs and practices. What I want to do is fix the system. This program that we use has been so heavily researched. That's why so many states have adopted this. And it's just an important service that we want to make sure people know exists. Gerald, you found it by finding it on your own. And occasionally we do find it, correct? I mean, people come to our classes and, yeah, I found you online.
Yes.
But most of our parents come from referrals. And so we're asking you folks know more about us so that you can make referrals to us. We want to be your partner. We want to be your partner in improving people's quality of life. Okay. So next slide, please. So these are some questions we're going to ask you, and we also want to open it up to you asking us questions. And somebody already submitted a question that I'd like to start off with, which is, what did I mean when I said intense children? And intense children means used by Tina Fagel, and I'll put in chat the name of her book and how to spell her name. She uses the term intense children, meaning children who have experienced trauma, the trauma of being separated from their parents, where their family has fragmented and they went elsewhere. And so they become intense, and we need trauma-informed care for children who have experienced that. They need to be heard. They need to be asked a lot of questions, not the kind of questions like, how was your day? Because nobody wants to answer that question, because what you're going to get is fine or worse. To know what kinds of questions that help a child learn to process what's going on for themselves, to learn how to develop their frontal lobe, for example. How do you make decisions when so much of their life is turned upside down? They don't get to make decisions. The decisions are made for them. So those are some of the things that we want to teach intense children. So I hope that helped answer that question. I think we have another question, but I'm not sure what it is. So, okay.
There were a few comments in the chat.
Oh, great. You want to, oh, here's one. As a New York State permanency mediator for the 9th District, my biggest issue is the limited training available for foster families to make them feel comfortable and ready to adopt and deal with the ever-present issues facing the children. I feel you, I do. Thank you so much for posing that. So like I said, I will respond to that by encouraging you to take a look at and reaching out to Tina Bagel. And if you have any difficulty, please reach out to me at etanner@familykind.org. Present Moment Parenting is the name of her book. And then it goes on, there's a second title, the subtitle mentioning the intense child. So there you go. But reach out to me. She does trainings to train staff to know how to work with parents in the foster care system. And then eventually, if we're able, wouldn't it be great if we could get foster care, caring parents, the skills directly that they need from trained professionals. Okay. Here's another one. I have recently become involved in the Parents as Healers program, and it too addresses parents who have experienced domestic violence, helping their children who are exposed to domestic violence issues. Thank you for that. Again, a family science professional. However, in this arena, when there is domestic violence, I would, I've got 40 years in this. I would say my limitation is in the DV community. I would strongly recommend a mental health provider. FamilyKind has great people who can help with that or make referrals to resources that those families and the children would need. So thank you for that. What I'd like to hear from more people is, how does family science, now that you know a little bit more about it, impact your role as a professional? What skills are you using? And also, do you have any questions? Let's hear from some folks.
Yeah, I like that. I'd like to hear from our persons out there.
Okay. So here's a question that I've gotten from professionals around the country. I train, as I had mentioned before, in 2 national programs, and parents, trainers, people who are being trained to teach the classes. One of the number 1 parenting education program in the country, in the world, as identified by the World Health Organization, not by Ellen Tanner, is called the Strengthening Families Program for Parents and Youth 10 to 14. That's a very long title. I'm just going to call it SFP 10 to 14. There's a long reason why that name is so long, but I'm not going to go into that right now. The most important thing is that out of 6,000 programs evaluated by the World Health Organization, this was rated as number 1. And the reason for that is the longitudinal studies that showed the reduction of children getting into trouble. Their academics improved. They were, the family disharmony that often occurs during adolescence and teenage years disappeared because they had the skills. They knew things like having a family meeting. They knew how to reflective listen, hear what the other person was saying. And they learned how to understand what children's goals of behavior are. You know, the number one protective factor for people, for primarily children as well, mostly children, is having goals. When we have goals in our life, we do better. We make better decisions based on the goals. So that's some of the skills that are taught in the classes. And I know many of you use reflective listen. You're excellent listeners. That's part of why people keep coming back to you, because they feel heard and acknowledged. They also, parents learn to use iMessages, as do the children. And they learn a vocabulary of emotions. You know, instead of saying, why do you always, or you never, they learn to say in a respectful tone, even though they may have had to take a few breaths to calm down, I feel frustrated when, and then they give the description of what the situation was. And I would hope that some of the skills that we're using, you too can adopt and expand upon what you're already doing. Somebody asked, I think in the class, I think family science helps to highlight the importance of active listening and not assuming the worst before questions of our clients, which is a skill we teach co-parents to use in communication with each other. Bingo, 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 bingo. I often tell people, if you learn nothing else from any of the classes that we teach, if you learn active listening, your life will be forever changed. And the good news is you already know how to do that. When you're a parent and your little kid comes up to you and says, Baba, Baba, you know, and holds their hand like this, you go, oh, you're thirsty. You want your bottle. Fact and feeling. And that's what we're teaching parents. What's the fact and the feeling? So thank you for using that skill. That's absolutely spot on. Makes a difference. Another question we have here is, how can we get health insurance companies to pay for this very important preventative tool? Oh, that's a $60,000 question. Okay, so that's my life's mission. Just so you know, when I ran into Tina the first time, that's what she was working on. She did research on her program and worked with Medicaid to make that happen. And so that's why she's one of my superheroes. I've met people at other conferences and they say, oh, I got my HMO to fund parenting education for this particular population. It could be parents, let's say, who have diabetes. And how do you teach them how to teach their children about it? You know, it could be very specific or it could be very broad. I'm open to your ideas. I don't know who you know. Do you know a legislator or legislatures, or know of other people that would want to champion this cause? You know, the organizations that I mentioned before, this white paper that we're updating, we're going to be promoting that on a national level through all the national cooperative extension offices, for example, because they're the founders of parenting education in our country. A lot of people don't realize that. Cooperative extension, our tax dollars pay for that. But we need to get insurance companies to pay for this too. We know that employers sometimes will give discounts on what their employees' co-payment is for insurance if they go to a gym or if they go to a lifestyle coach. Why can't we get more employers to fund parenting education? Or if you take a parenting education class, that reduces your payment. That's one example of how things can evolve. Another example, the IRS, in order for nonprofit hospitals to get their status, they have to give a certain amount of money back to the community that they serve. We need to get the IRS to recognize when the hospitals provide parenting and family education, that's giving back to the community and something that would be counted. There's no limit to how we can address making parenting and family education the norm and a recognized profession. Gerald, is there anything that you would like to share? I'm sorry I've monopolized so much of this.
There's so much information that you have being a part of this for so long, I sit and listen and learn and continue. There was one question. There was 2 training programs that you had mentioned. Someone wanted to ask about those 2 training programs, or what were they?
Thank you. I'm actually typing that answer in now. Okay. So the 2 parent education programs or family education programs. One is the Strengthening Families program for parents and youth 10 to 14. And if you just Google SFP or Strengthening Families program 10 to 14, you would find it. And the other one is the Systematic Training for Effective Parenting. Here's the difference. The Systematic Training for Effective Parenting, we're just going to call that STEP. STEP is of all the parent education that have since grown, it is the foundation for all of them. 40 years ago, there were 2 parenting education programs in this country. STEP was one, and Parent Effectiveness Training was the second one. PET kind of fell by the wayside. STEP grew. Thank goodness for Dinkmeyer and McKay, the 2 authors of the program. And I was privileged to become one of the first people trained in the curriculum, and it has since grown. But it is for parents only. The Strengthening Families program 10 to 14 is different. It has the same content for the parents, not exactly, but very, very similar. There's also, though, a youth component. So while the parents are having their session, the youth are having their session. And then they come together for a family session. And very often agencies refer people to this program. And by the way, there's a lot of SFP trained agencies in New York, and even including in the criminal justice system. There's SFP 10 to 14. And if you're interested in this, let me know and I'll hook you up with the right folks. So SFP, what happens is when they come to the program, particularly the kids, a mom or a dad will say, we're going to the program. And the kids come in and they're like this, and they've got a scowl, and their arms are crossed against their chest. And sometimes even the co-parent is like, I'm not interested in this. And then by the 3rd session, they're hugging and they're talking with one another, and they're loving coming to class, and they've made friends. And I even had grandparents raising grandchildren once take the class in a very high-risk community. And those parents the grandparents stayed in touch once a month for years and years and years. Had I known then what I know now, I would have done a research project on them. And the reason I know that they succeeded is because every year, 1 month, at one of the meetings, they would have me come back. All of those kids graduated high school. All of those kids either went on to a job, additional technical training, or college. And all the grandparents still were meeting. So it's wonderful in a community. However, SFP programs are typically funded by grants. And when grants go away, so do the programs. And so this is why we need to infuse the services. Like I said, local hospitals could run SFP programs, SFP 10 to 14 programs. And the reason I'm clarifying 10 to 14 is because there's another Strengthening Families program as well. So those are the 2 programs. If you're interested in becoming trained in either of them, let me know. I'd be happy to work with you on how to make that happen. We have another message here. What has disturbed me most and has carried with me is some kids I worked with were ripped away from their foster families, although the kids were so happy, because the foster parent was never given proper training. This truly needs to change. I agree. All right, somebody's saying they would like to attend the training, but I don't know who that is. So maybe that person can, oh, I see that there's a name. So
Just Kent.
Okay, Jess, if you can put your email address in there for me, I'll follow up with you. And also identify which program you'd like to be trained in. I would strongly encourage you to join our class tomorrow night that starts for 7 sessions, if that's the class you're thinking of. Or if you'd like to become a parent educator like Gerald is, let us know that as well. We have a whole stable of wonderful parenting educators because we are in multiple counties. And we're not going to open up that broadly in the fall, but shortly thereafter. And we're actually scheduling a review training for that class because it's been a year and a half for our parent educators. And that's really important. So Gerald, Jess Kent would like to follow in your footsteps. So thank you. Those are very.
I welcome you. I welcome you. Please come along. It is the heart of my, is the core of my being right now to well, let me just share just being right there in the midst of sharing with the parents that were going that are doing the divorce, doing the transition with the divorce. Understanding that come from was amazing to me, and sharing with them and allowing them to see that life was not happening to them, it was happening for them. And when that took root, it opened up a whole new world. I mean, the walls come crashing down. I lack the words to express what happens in these classes. And again, it's the empowering of understanding that you know, life doesn't stop because, you know, we're parting paths. You know, and the whole attitude now when they go into the courtroom, the whole their demeanor is different. The defenses they understand, and that's what this is pretty much what it's all about. Having the individuals be more applicable to what you're trying to do for them, and again, it's, you know, what's happening for them and not to them, and so I always, you know, I listen to what you say, Ellen, you know, but you know, I've been in the trenches with these people, and it's just beautiful to see the whole how it I invite each and everyone on the panel, come to the class, participate, see for yourself. It's amazing, you know, to watch the defenses go down, and you know, it's amazing. And you know, because I can really speak from that perspective, you know, being in it, and you know, and then continue to learn more and more about it, the intricacies of the family science family. So it's amazing to see it happen and unfold right in front of your eyes. As Ellen had mentioned, my son's mother partook of one of the classes, sat right there, and you should have saw the expression on the participant's face when I said that there is my son's mother right there taking. You know, it was a gasp. it was amazing. This works. It works, and we need more of it. And the more that we can speak family science information to the community is what our families need, so that they better use the tools, the information and the stuff that these individuals that are participating in this provide for them, and not shun it. You know, we want them to be able to utilize the services that we provide, that each and every one of us provide here.
You know, I want to circle back to something that you pointed to, Gerald, which is so important, which is why are there so many states that implement this program that we do, is because, and by the way, we're not the authors of the program. I was one of the first editors of the program, but I did not author it. This is strictly Dr. Don Gordon's brainchild, and Abruthnut, his other co-author. But the reason that people accept this class as a mandate is because 57% reduction in relitigation has drastically lowered the drain and strain on court system. 57% reduction. Why aren't they relitigating? Because they're working out their issues on their own from a single session class, which is pretty remarkable. I also added a quote of yours, Gerald, that is on my tagline in my emails, which is, asking for support isn't a sign of weakness, it's a sign of awareness. So, and that's not just if you are the parent, if you are the professional and you want to increase your tools in your tool belt to serve your the clients that you have, like attending this webinar. Thank you so much for doing this, spending time with us. We genuinely appreciate it. The other thing that I'm hearing from another person is that the departments of welfare in various states should be brought on board to support parent education programs. At a minimum, if parents could effectively communicate about money better, I believe it would bring down the number of parents who are forced to go on welfare because one or the other parent refuses to contribute to ongoing financial support of the child. Bringing down the welfare rolls would help not only the taxpayers, but also help reduce the intergenerational cycle of poverty. And couldn't agree with you more. We would love to have more. We get a lot of welfare agencies and other agencies that serve people in dire situations to our Zoom parenting class. Not as many to our class for parents of divorce and separation. That's a great idea. Something we might want to explore is how do we reach out to them so they can refer people to our class. Our classes are offered, our in-person classes are on a sliding fee scale. We offer scholarships to parents for our Zoom class if they can't afford it. We'll offer a scholarship to a professional if they want to attend the class so that they can help make more informed referrals of their clients to our classes. But even still, that 7-session class is $49. The single session class in person is anywhere from $0 to $100, and online it's either $0 or $100 or $95 and change. So, we're a nonprofit organization. That's why we truly appreciate our sponsors who help us put these seminars on, webinars on, and some of our other services. So we have 2 minutes left. Is there anything that anybody else would like to share? I see one more new message. Oh, I see a thank you to us, Gerald, in our chat. The thanks to you also for joining us. Much appreciated. I look forward to hearing from you. The very last slide, or is that our last slide? That is our last slide. Okay, so our phone number, FamilyKind.org, is the easiest way to find us. Our phone number, if you need it, and you're entirely welcome, the next people who are writing in. But I'm going to put in our phone number in chat if you need to call FamilyKind for any reason or to reach out to us. There you go. And thank you, everyone. Gerald, do you want to have, you're so wise. Do you have a closing sentence for us?
Theodore Roosevelt. No one cares how much you know until they know how much you care. And that drives me. That drives me. And to share this panel with each and every one of you peer to peer, I know that y'all prescribe to the same thing. Because when you realize that people realize how much you care, they open up to you and you can actually help and show them they're welcoming to you. So yeah, that is one of the main things with me. No one cares how much you know until they know how much you care.
Well said. Thank you, everybody. Bye-bye.
I just have one closing remark to add to the end. Thanks again to everyone for being here, and to Ellen and Gerald for all of their insight and wisdom that they were able to impart upon us today. This was the final peer-to-peer webinar of the spring. There will be a break over the next couple of months throughout the rest of the summer. And we hope that you all have a wonderful summer break after this rather hectic year that's now behind us. And we are excited to relaunch the peer-to-peer program back again in September to continue through the end of 2021. And we will provide that information as soon as those events are set. Thank you to the sponsors again, Our Family Wizard and SoberLink, for making this possible, and to everyone for attending today. We hope you have a great afternoon and be well.